You're about to see a video that came out early 2024 that should have come out actually 25 years ago. Because as an eye doctor in private practice, I can attest to the medical corruption that was going on that they're going to expose. But more on that later.
The average, say, 65-year-old person in this country is on how many drugs?
About seven.
Seven.
Yeah.
And not just intermittently, but like over
Chronic.
years.
Chronic, around chronic, a lifetime. It's more recurring revenue.
When I was in private practice as an eye doctor, it is true. And because I was in private practice in a community that was very high in type 2 diabetics, I recall that the numbers for my private practice were high 20 years ago. And here we are talking about this video now that's 2024, where these numbers are now across the board for the US, which means, by the way, we're getting more unhealthy as a nation.
So describe what that looks like.
I'll give you an example. My mom. So my mom was 71 and went, for a checkup and was told by the doctor she was healthy. And she was actually at the time on 7 lifetime medications.
Here he said that his mom was considered healthy, but she was on 7 lifetime medications. This is very common when I interview men for the program to help them to get rid of belly fat. They come into the interview and say that they are fine. But when I start asking them what kind of medications they're on, they start listing these medications, and most likely high blood pressure medication, high cholesterol medication. Guys, if you're taking medication, you are not fine. There is an underlying problem. But herein lies what they're talking about, that doctors have normalized taking medications as meaning you're fine, even to the point of saying you're healthy as long as you take the medications. But let's call a spade a spade. If you have to take medication, you are not healthy. There is an underlying problem that needs to be resolved. But here's where the corruption comes in.
So she was on, maybe a decade before, had high cholesterol, was prescribed a statin. And the message from the doctor was, no problem. Most, the majority almost of people your age are on a statin. No problem. That's a rite of passage. Then she had high fasting glucose. Again, that's basically prediabetes, which majority of people have. Metformin, one of the most prescribed drugs in the country, high blood pressure. So she has these comorbidities that are almost seen as like rites of passage.
All of the drugs he mentioned, the metformin, the statins, all of the medications he mentioned that his mother was on was so common when I was in private practice. It was to the point when a patient would come in and I would ask him what drugs he was on, he would say, well, I can't remember. And I would just guess and say, are you on a statin? He goes, oh, yeah, that's what I'm. Are you on a high blood pressure medication? Oh, yeah, I'm taking one of those too. So it was very easy back then because it was so common for people to be put on these drugs. So much so that an eye surgeon friend of mine, I was having a discussion with him and we were both commenting on how frequent our patients were being put on these drugs. And it was to the point where we were scratching our heads and wondering what's going on here. But remember, this is talking about me being in private practice 20 years ago. But yet this discussion hasn't come out until 2024. So this is why I'm bringing it to your attention so you are aware of what's going on.
It's a rite of passage for a man over 40 to be on a statin. The majority are. So these were all kind of normal things. So as we've treated everything in silos, that's a lie. Heart disease, diabetes, in many ways depression, Alzheimer's. We've actually lied, saying those are different conditions, seeing 4 different doctors for 4 different treatments that don't even talk to each other. So we're managing the symptoms instead of seeing those symptoms and realizing that we have a root cause metabolic crisis. That's why the more statins we prescribe, the more heart disease goes up. The more metformin we prescribe, the more diabetes goes up. The more SSRIs we prescribe, which are now 25% of women.
The higher the suicide rate goes.
We're seeing skyrocket. So we're siloing everything.
Statin drugs are prescribed to the majority of American men over 40?
The last rate, I think 2019, the last study I said was 45%. And I think there's reports that now post-COVID, it's close to 50%.
So what's the downside of statin drugs?
Oh, there's wild research coming out. I mean, the highest level, just even if the drugs don't have no side effects, heart disease isn't a statin deficiency. What statins to me at the most important level represent that we have a moral hazard. Fundamentally, when you're prescribed that statin, you're told by the doctor that you're doing something. When you're prescribed the Ozempic, the doctor, Fatima Stanford on 60 Minutes, who's paid off doctor from Ozempic, said, throw willpower out the window. This is a brain disease. Food isn't the problem. It's a medical issue. Take Ozempic. Do not worry about what you're eating.
This is exactly what Purdue Pharma said about pain.
Yeah. So you have these messages. You have the statins. You're doing something. You now can eat what you want to eat. Until 2018, the American Diabetes Association said that as long as you take your medications, you do not need to change your diet as a diabetic. So you literally have guidance from the American Heart Association, from the American Diabetes Association, now from the obesity industrial complex, saying that if you take these drugs, you're good. But that's a lie, because there's never been a drug in American history for a chronic condition that has lowered the rate of that chronic condition.
Okay, so I'm going to interject here about the first thing of Ozempic. For those of you who are thinking of taking or are currently taking the injection drug for obesity, it is a $1,200 per month drug. And that is a drug that you would have to take for life in order to keep the obesity from coming back. The problem is that drug cannot be taken for life safely. So whereas when it comes to all of the drugs that he was talking about earlier, high blood pressure drugs, high cholesterol drugs, high blood sugar drugs, those drugs have side effects also, but it takes a lot longer for side effects of those drugs to rear their ugly head. And so this is why I think corruption has gone on so long when it comes to the medical industry, because these drugs were just enough to make you think you were doing something when it came to managing symptoms, but not enough to reverse the underlying problem, and not enough to kill you right away where it became a taboo to do. So here we are at this point where I'm trying to let you guys know that this is the same game that the pharmaceutical industry has played over and over again in just different conditions. And now we've come to a point where we're using a drug to treat obesity. And like they say, it's not a lack of Ozempic or a lack of Mounjaro that you are obese. Obesity comes from not knowing when to eat, what to eat, and how to eat, and also believing in the misinformation that's out there. This is becoming a huge financial cost, not only to you, but to our country. But let's go back to you. For those of you who are taking these drugs, like when I was in private practice, most of my patients had medical insurance. So their insurance was covering the bulk of the cost of these drugs, but they had copays. Over the course of 1 year, the average cost for you guys that are taking about 7 pills per day that are prescribed, you're going to be spending out of pocket about $1,300 per year. And to remind you, most of you have been on these drugs for a number of years, and it's quite common for you to be on these drugs for 10, 15, 20 years. So do the math. $1,300 over 10 years, that's $13,000 out of pocket that you're paying for drugs that do not resolve or reverse the underlying disease. Let that sink in for a moment.
It's more than the defense budget.
U.S. government spends more managing diabetes than it does on defense.
If you want to stack rank what would bring down the American Republic, it's not, marginal rates of military spending. Our biggest line item in our budget, the biggest part of our economy, is healthcare, and it's also the fastest growing industry. Healthcare is the largest and the fastest growing industry in the United States. The bulk of that spending is coming from government, and as it grows, it produces worse results. We're training doctors, medical schools, pharma companies, hospitals, doctors, nurses, insurance companies. They make money when people are sicker for longer periods of time. The way to do that is to silo conditions. That's why Ozempic is so important, because obesity is not a siloed condition. Obesity is a visible example that we are losing our way as Americans, and treating that in a silo is just medically not going to work, and it's happening because of corruption.
Okay, so I want to go back to what he said about silos. I was part of that problem as an eye doctor. It was my job to make sure that they did not go blind from their health problems, which were typically the high blood pressure, the cardiovascular disease, the high blood sugars. my problem is I would look at the patient and ask them, are you taking your medications? Because I'm seeing blood in the back of the eye. The patient would say to me, yes, I am taking my medication. And I have to apologize because back when I was in private practice, I believed that those medications should have been working. So I thought that the patient was lying to me about taking the drugs. But no, they weren't. They were taking the drugs, but the drugs weren't intended to reverse the health problems that those ailments can cause. So again, the silo that he talks about is exactly right. We stay in our own lane and we don't talk enough to the other medical doctors that are treating our patients. And that way everybody's kept in the dark. So if you want to be somebody who's not kept in the dark about your health problems and your goal is to get rid of belly fat so that you can reverse disease, because my specialty is working with men that are 50 and over, getting rid of belly fat without diet or exercise so that you can get on the road to better health and longevity. So click the link below this video. That's my calendar. You can get on that to talk directly with me about what your situation is. And I look forward to talking to you on the other side.